Welcome. My name is Dr. Mario Leyba. I'm a general and robotic surgeon here in Albuquerque, New Mexico. We're going to discuss several things today, specifically regarding patients, how to care for them in surgical wise, and how to make you feel more comfortable. I'm going to see you in my clinic. We're going to talk about things, but today we're going to give you some information so you can process. So when I see you later, we can have a good discussion. Thank you. The reason for making these videos was to help the surgical process along. I've seen it from a surgical standpoint. I know how to do the surgery, I've seen it in clinic and so forth, but I've never really dealt with being a patient. And when patients come to my clinic, oftentimes they're overwhelmed with the amount of knowledge that I give them and other doctors, and they focus on that rather than listening to what's actually going on. So when they go home, their family members ask them, well, what happened? A lot of times they're like, I don't remember anything. So the reason for this is to help educate patients and family members and even providers and other people that want to be involved in the surgical procedures themselves. What is a hiatal hernia? A hiatal hernia is a problem where part of your stomach pushes upwards through your diaphragm into your chest. They can be small or large and can vary in presentation. What are the symptoms of a hiatal hernia? Symptoms may include heartburn, belching, difficulty swallowing, chest or abdominal pain, feeling really full after eating, black stools, or vomiting blood or undigested food. What causes a hiatal hernia? It occurs when a weakened muscle by your diaphragm allows your stomach to bulge into your chest. Normally this area is snug to your esophagus and does not allow a bulge to form. It is not always clear why this happens, but increased abdominal pressure from your stomach and abdomen may contribute to the hernia formation. Obesity and older age increase your risk. This bulge then causes your stomach and esophagus to display the symptoms as described earlier. How is a hiatal hernia diagnosed? It is diagnosed by an upper endoscopy called an EGD, where a small camera is inserted into your stomach through your mouth. It can also be found in a barium swallow or other imaging study. Lab tests may suggest bleeding and prompt an endoscopy. Other tests like manometry and pH testing further characterize the hiatal hernia. How is a hiatal hernia treated? A small hiatal hernia may need no treatment. Symptomatic hiatal hernias are first treated with medications to relieve the symptoms and lifestyle modifications, such as small, frequent meals, avoiding large or late meals. This will help alleviate some symptoms. Surgery is recommended for failed medical and lifestyle management or for severe symptoms or complications of the hiatal hernia, such as a twisted stomach or volvulus, which causes a blockage that can lead to bleeding or perforation. How is the surgery done? Most hiatal hernias are repaired minimally invasive with small incisions. I basically fill the abdomen with CO2 gas and insert my instruments to allow repair of the hernia. This is called laparoscopy. I do the repair using the robotic Da Vinci system. I bring the stomach back into the abdomen and close the hiatal hernia defect to reinforce it with a special material to help with healing and recurrence. I may also do a stomach wrap around the top part of the stomach called a Nissen fundoplication to help with reflux. I do this by suturing the stomach to itself. What are the benefits of robotic surgery for hiatal hernia? I know how to do all of the techniques for hiatal hernia repair, including open repair, standard laparoscopic repair, and advanced laparoscopic robotic repair. I prefer to use a robotic surgery because in my hands it gives me several things. Number one, a small cosmetic incision with rapid healing and reliable pain profile. Number two, superior visualization at the time of surgery with high definition three-dimensional visualization of the difficult anatomy of that area compared to standard laparoscopic surgery which only sees in 2 dimensions. And number three, the multiple robotic arms and versatile instruments allow for easier suturing and closure of the hiatal hernia. This comparison to other methods helps me. I also have 3 working arms which allow me to switch between them for better retraction and dissection at the time of surgery. The robotic system allows the surgeon to control all aspects of the repair and instrument use, and I don't need to depend on an assistant to direct the camera or the instruments. Is robotic surgery safe? Absolutely, it's very safe. It is rapidly growing as the preferred method, especially amongst minimally invasive surgeons in large cities in the United States. These surgeons are trained in both laparoscopic and robotic surgery. All methods of repair are safe if done properly and have similar outcomes. What are the risks of surgery? All surgeries have some degree of risk, but surgical risks include, but not limited to, bleeding, infection, injury to the esophagus or stomach, and surrounding structures, hernia recurrence or wound complications, collapsed lung, difficulty swallowing after surgery if the surgery wrap is too tight, or recurrence of reflux if the wrap is not tight enough. These complications are rare and are more common with emergency surgery and long-standing disease, but can be treated if they do occur. These risks can occur regardless of the method used to repair the hernia. To contact Dr. Mario Leyba, call 505-727-7050 or go to the website at www.loveless.com/Mario-Leyba-MD.